about that crazy MS bladder. So, did you know that over time, almost 80% of people who have MS will have some kind of bladder dysfunction? That's because, of course, there are lesions that cause blockages in neurotransmission to the part of the central nervous system that governs bladder function, bowel function, that whole lower body thing that is so common in MS. And it's that part of the central nervous system when we talk about bladder or sweating or, heart rate, breathing rate, all of those things are governed by the branch of the central nervous system called the autonomic nervous system, or an easy way to remember that is automatic nervous system. So all those functions that the body does automatically. So autonomic nervous system lesions that are blocking that, over time, 80% of people with MS will have some kind of bladder dysfunction. It's also interesting to know that bladder dysfunction is huge in our culture in general. So I see a tremendous amount of, especially women with bladder dysfunction. I think it's that whole pelvic floor, especially if you're having babies and doing a lot of lifting, that kind of stuff, that really takes the wear and tear out of the pelvic floor. And of course, as a culture, what do? We sit around. So we're not actually strengthening that pelvic floor. So what exactly is bladder dysfunction? Well, if you're on this call because it relates to you, I don't have to tell you. It could be urgency. It could be frequency, increased frequency. It could be hesitancy to even start going pee. It could be retention. So you just can't go to the washroom. Your body retains that urine. Nocturia, which is getting up multiple times during the night to go pee, or simply incontinence, where you just can't hold the urine at all. All of those are signs of that dysfunctional bladder, and we're talking about that in MS tonight. It can be a real confidence killer, right? It can be a real social killer. It's something that people are reluctant to talk about because, like it's a big secret that everybody's body excretes waste. So like we need to remove the stigma from this and talk about it openly and frankly. And that's what we're doing tonight. Okay. So, the good thing I want you to know is that it can change for the better. And I'll share my own personal story with bladder dysfunction. When I was first diagnosed, I was going to the washroom every 45 minutes. And then about 5 years later, I was going to the washroom every 15 minutes. So I was working in the corporate world at that time, and 2 jobs in a row. I very keenly scored a job that was right across the hall from the ladies' washroom, which was an absolute, having it on another floor or an elevator ride away would have been a showstopper because that just wasn't an option. But over time, now I'm fine for 2-3 hours at a time. So that's the message of there's hope, we can improve. Okay, so let's talk about what's actually going on in the bladder. Okay, so I think ultimately the big one that you will, if you Google it, you'll find everywhere, is that it's spasm in the bladder and even like in the muscle of the bladder. So the bladder is a muscular organ, and in the sphincters of the bladder. So the sphincters control the ability to release. So it's either spasming and opening too much, or spasming and clamping shut for people who can't even initiate that. Stress and anxiety impacted hugely because remember we said it's part of the autonomic nervous system. So what's also the autonomic nervous system is that sympathetic or stress response versus the parasympathetic or relaxation response. So when the body is revved up and we're, producing all kinds of stress hormones, that is going to irritate the bladder, and the equal and opposite relaxation response will actually help to ease. So this is a specific, I've heard it to be very specifically helpful in people who have that hesitancy and just can't get their stream of urine going. Terrain. You've heard me probably say the word terrain. As a traditional naturopathic doctor, I'm always looking at the overall terrain of what's going on in the body. So when I say this can be a terrain issue, then by that I mean microbiome, because we talk about the microbiome in the gut because that's where a huge percentage of it is. But that microbiome also extends into the bladder, into the vagina, the lungs, the sinuses, all have their own microbiome. So that microbiome can be injured. It can be inflamed. There's something called asymptomatic bacteremia that I've run into a number of times with people with MS, where they, and it's not just MS, but the E. coli counts in their urine are very, very high in the lack of symptoms. So there's no symptoms. And even on a dip, there won't be any leukocytes, which indicate infection. But because the E. coli is high, they'll get hit time and time again with antibiotics, which is definitely not what you want to start doing, because that will wipe the microbiome out. So we want to rebuild the microbiome. We don't want to wipe it out with antibiotics. And then the and then with the autonomic dominance, so that's sympathetic. So the stress and anxiety falls under that autonomic dominance. So stress response dominant personalities, situations. You may have been in a situation where all of a sudden you got to go pee, right? And that's because your body is in the stress response, where if you're nervous, that'll trigger it. It is important to manage the bladder as effectively as possible to avoid infections and damage that can be the result of infections. So we always want to make sure there's not infections going on. You might even want to see a urologist if you're concerned. Like a urologist, they can do what's called urodynamic testing. So they'll test flow rates. They'll see how much retention your bladder has. They just examine that whole urinary tract function. They'll measure the pressure of the flow and the volume of the flow. So, a urologist is somebody you can see if you feel like you need a greater evaluation or assessment of your pelvic floor, of your whole pelvic floor. So it's a lot easier now to rule out urinary tract infections than it ever has been, because you can buy the dipsticks on Amazon, and it's not rocket science. I've done it for 20 years. You catch your urine in a clean cup, you stick the stick in it, and then you match it to the numbers and the colors that are on the container. Okay, so I'm gonna tell you some of the important ones there, and I always recommend that if any of these are positive, you see your doctor or your naturopath or your functional medicine practitioner, whoever it is that you have as your primary care. But if any of these are positive, you need to seek some help. The first one is leukocytes. And leukocytes are the infection. They're the white blood cells that are detected in infection. So if your leukocytes are even there, they shouldn't even be a little bit. If they are present at all, that means there's an infection. The next one is blood. So you don't ever want to see blood in your urine. If you've got leukocytes and blood, that probably means that you've got an infection. Blood can be anything else. It could be, obviously if you're menstruating and you do a urine dip, then you could have blood in your urine. But it could also be a sign of something more serious. Protein is another one. So for example, if you've got blood and protein in your urine, yeek, I want you to run to your doctors, because that means something else is going on. But protein is actually usually a very good sign that something is wrong with your kidneys. Your kidneys are starting to fail. And another thing you don't want to see in your urine dip is glucose, because glucose is blood sugar. So if you've got blood sugar spilling into your urine, you really need to think about your blood sugar levels in the rest of your body, because of course your kidneys filter your blood, which ends up in your bladder for excretion, right? So there might be some unknown diabetes or unmanaged diabetes going on. And God knows that's super important in multiple sclerosis. Or it could just mean something else is going on that's damaging the kidney. And ketones are the last one. And ketones are, this is in the absence of a keto diet. So if you're on a keto diet and you've got ketones, yay you. That means you're in the zone. But if you're not on a ketogenic diet and you've got ketones in your urine, once again, we're looking at diabetic ketoacidosis, which is a complication of diabetes. So, once again, don't freak out if you're on a keto diet, but if you've got ketones and you're not on a keto diet, you need to have that checked out. So just to review that, you can get urine dipsticks on Amazon. You want to rule out to make sure that you don't have any bladder infections, or if you do get them more frequently and you want to make sure they're clearing them, then you can have them at home. I noticed actually when I was looking earlier today that they come in, like when I had the clinic, you got a big jar of them, right? And of course they have an expiry date. Now you can get them in like smaller sealed packages, so you're not opening and exposing the whole lot to the air, so they don't go bad as quickly. So once again, the things that you're looking for: leukocytes, blood, both of those a sign of infection, right? Protein, sign of kidney damage. Where did we go there? Glucose, right? Blood sugar spilling spilling through the blood into the kidneys. And ketones. So ketones in the absence of a ketogenic diet. Okay. Now, I am gonna dive deeply into what you can do, because there's so much you can do. I mean, because people don't talk about bladder, you don't talk about going pee, or you don't talk about your bowels, because, who wants to talk about that? But we need to talk about it. But I do want to address kind of a worst case scenario, and it's not a worst case scenario. It is what it is. But in some cases, to improve quality of life, people with bladder situations in MS require catheterization. So I want to talk about that a little bit, because I've been working hard with my patients over the last couple of years with a different tack on catheterization. So, if it gets completely unmanageable with the frequency and urgency, and it's just accident after accident after accident, then you know what? You might be required to, or you might be more comfortable. You might choose to catheterize, right? Another instance where catheterization happens is when there's the retention and the sphincters are slammed shut, and you just can't void. So that requires self-catheterization a couple of times a day, 2 or 3 times a day, just to completely void the bladder. And that can be tricky, because if that sphincter is jammed shut like that, trying to get a catheter past that on the way in and on the way out can be a real problem. So it can take people with that retention problem a little while to catheterize. Something that I've been working on with people over the last couple of years is called a suprapubic catheter. And so, especially if you spend a lot of time sitting, a catheter that is inserted vaginally might, or up obviously through the ureter, might not be a good idea, because you might end up with repeated urinary tract infections. It may come out, when you're transferring or standing up or moving around. So a suprapubic catheter is a surgical procedure to get it installed. But the people I have suggested it to and who have spoken to their urologist about it, first of all, their urologist was all over it and sort of like, oh, yeah, why didn't I think of that? And they love it, because they just cut a small incision below your belly button and feed the tube in that way. And you can clamp it off if you want to have a shower, or if you want to go swimming or something, you can clamp it off, and it's not a problem. It's not like the other catheter. So other ways people use catheters, I know I have some patients who use a catheter when they travel. They just don't want to have to worry about where's the next washroom, or is there a line on the plane, or whatever. So they self-catheterize, and they do that, of course, with the aid of their nurse practitioner or a family doctor or whatever the first time. But I've got people that have been self-catheterizing episodically, if you will, for special reasons for years and years and years. And I did a quick search on YouTube. You have no idea how many videos there are on YouTube to show you how to self-catheterize. And you know what? If that becomes a thing of convenience when you travel and you don't have to worry about, finding a washroom, or worst case scenario, pee in your pants, then it might not be a bad idea. It becomes a tool that you use by choice to improve your quality of life. Okay. And of course, men have it easy. I mean, the traditional male catheter still gives me the heebie-jeebies when I think about it, because they pass a catheter through the ureter all the way up inside the penis. Like that, just, you can see, right? You can see it, that just gives me the heebie-jeebies. But now they have these condom catheters. So it just gets placed on like a condom, and I understand from people that they're very comfortable and very practical. And once again, the men that I know that use it when they go out in the garden for the afternoon, or when they travel. So once again, it's a tool, right? It's a tool that enhances participation. Okay. So now that we've looked at, we want to rule out infection. We want to address catheterization if you need it, or if you want to use it as a tool. We know that what's going on is spasm. It is stress and anxiety, or the autonomic dysregulation. It's a terrain issue. So when you think of terrain, think of inflammation, think of microbiome, that asymptomatic bacteremia, which isn't all that common, but I have seen it a number of times over the year. So what are we going to do about it? So let's talk about that. And this is the fun part, because there's so many things that you can do that are simple, that are super simple. So first and foremost, you still need to drink liquid. And this is, I get it. I've been there. It becomes an issue when you've got especially the frequency and urgency stuff, and inability to hold urine. But your body needs water for everything else that's going on, and it might be counterintuitive, but if you can think of the bladder, the empty bladder, as kind of spasming, that muscle, it's a muscular organ, remember, as spasming away, to have some weight in that in the form of liquid can actually help with that urgency and frequency. And of course, it reduces the risk of infection as well, because you're clearing that out. What's the first thing they tell you to do when you have a urinary tract infection, right? Drink lots of water. So always continuing to drink is a super important thing. So have a strategy around that, just sip throughout the day. You always see me sipping tea. And that's the way I do it through the day. I have little bottles of water all over the place. So when I stop, oh, I'm in the kitchen, there's a bottle of water, I'll take a sip. So whenever I see that bottle of water, I take a sip. So it's not about sitting down and chugging 8 glasses of water, because that's what somebody told you needed. And by the way, if you're currently drinking 0 glasses of water, don't think you're going to start with 8 glasses, because your body will go crazy. And also, an important thing to understand is things like coffee, or caffeine in general, pop, they're all dehydrating. So if you're drinking 1 to 2 cups of water a day, but you're drinking 2 cups of coffee, 1 cup of coffee equals negative 2 cups of water. So that means you're already at a water deficit, because you've had more coffee than you've had water. So what you want to be drinking: pure water, like good filtered water, herbal teas, and I'm going to mention some specific herbal teas, and of course green and white tea. They also count. A little disclaimer: as long as you don't have any problem with caffeine. Caffeine is the big green meanie here, so we want to get rid of it. But for some people, there have been times in my life where I couldn't tolerate even the 30 milligrams of caffeine in a green tea. And right now I drink about 6 cups a day. So it doesn't bother me at all. Cheers. Okay. On days when you know you're not going out, then you can drink a little bit more, because you're right there, right at home, and you can do kind of a water catch-up day, if you will. Okay. Next, I want you to think of anti-inflammatory everything, right? So that inflammation and irritation is going to feed into that bladder dysfunction as well. So diet is key, right? So you've got to be on that anti-inflammatory diet. And I say you've got to be, everybody in North America should be taking a page out of the anti-inflammatory diet, because we've never been fatter or sicker than we are right now culturally. And not just North America, but any Western, I know we've got folks on the call from the Netherlands and from Germany. And yeah, everywhere now that follows the Western model is going to be in that same inflammatory diet state. So gluten-free, dairy-free, sugar-free, right? I actually read a small study on spicy foods irritating the bladder. Well, what do we know about spice? They come from peppers. And what are peppers? Peppers are nightshades, and nightshades are contraindicated on an anti-inflammatory diet, precisely because they irritate the body. It would be a good time, if you've got really bad bladder issues, it would be a good time to maybe do some food sensitivity testing. If it's bothering your gut, it's in the same neighborhood, right? The things you want to eliminate, once again, are caffeine, alcohol, and what our American friends called soda. In Canada, we say pop, but things like Coke and the like, right? And by the way, it doesn't matter if it's 7-Up and it's clear, it's still pop. It's still soda, okay? Herbal teas that you might want to look at. And I'm a big fan of getting medicine through teas. And a tea is maybe steeped for 1 to 3 minutes. If you want to make it a stronger medicine, or what we call a decoction, then just let it steep longer. Just let it steep longer. Some of the first ones that come to mind for me with regard to the bladder are corn silk. Corn silk tea is a good one for bladder stuff. Nettle, so stinging nettle, is a great one. Cranberry juice is another is another something, especially if there's infection involved, because cranberry juice prevents the E. coli from attaching to the walls. And parsley. So parsley is a great diuretic. Okay. So some supplements that might be helpful. And remember, you know how I feel about supplements and transforming MS naturally. It's not the same thing. Natural health is not about bottles of supplements. So we've talked about anti-inflammatory diet. We've talked about some teas. Now I'm going to talk about some supplements and some other things. So it's never just about the supplements, right? But I know how frustrating this can be, so I really want to work with you on it. Pumpkin seed oil has a great affinity to urinary tract stuff and certainly urgency and frequency. So you can get that in any health food store. They come in capsules about 1,000 milligrams or 1 gram. And you know what? You always have to play with stuff to get your own dose, but 1 or 3 of those a day. And it can take up to 6 weeks to take effect. So you got to take it for a little while before it'll be helpful. I actually looked online because there are always new things coming up, and I reminded myself of a couple of things that I've used with patients over the years with good success. And one of them is called Saga Pro. And Saga Pro comes from Scandinavia somewhere, and it's just straight Angelica archangelica. So it's just a single herb, and it's been used very effectively for especially the urgency and frequency. And I'm just realizing that I'm talking about urgency and frequency with regards to these, but that's because I don't have a lot of patients that have had the retention problem. Hesitation for sure, but not that retention. I've got 1 or 2 that pop into my mind where they had to self-catheterize. So I haven't used any of these supplements on them as from a regulatory perspective. But Saga Pro is something that's made by a company called Terry Naturals, Terry. Bell, Bell, is a company that has been around for decades, making herbal teas and stuff. And they have a capsule form that's called Bladder 1 for women. I looked at the ingredients. I can't imagine why it wouldn't be Bladder 1 for guys too, but they call it for women. And then I just remembered there is a product called Better Woman, and I think they also have a Better Man formula, and it is a traditional Chinese medicine herbal combination. And I actually did a study in my clinic decades ago with the woman who owned the company, and that was also very effective. So you got to remember, you've got to give it time to work in your body. I would say 3 to 6 weeks is like a minimum. And if you don't notice anything at 3 weeks, then keep taking it until 6 weeks and before you make a call on that. Okay. So there you go. There are some of the things that fall under the anti-inflammatory, because that's essentially what those herbs do. Is they take inflammation down through the urinary tract and balance it out as well. The next thing, of course, what do I talk about more than anything? Stress reduction, right? So deep breathing, regulating that. Even if you're sitting on the toilet, doing the deep breathing to regulate that flow. And visualization, just visualize things happening the way they should be happening. And stress reduction through the day too. I think you've heard me say enough. If there's anything you focus on, make sure that it's stress reduction. Castor oil packs. Castor oil packs, putting them on over the lower pelvis is going to take the inflammation down. It's also going to reset that autonomic nervous system. Remember, It takes you out of the stress response and puts you into the relaxation response. And I would even maybe put a couple of drops of an essential oil on it that would right on your castor oil pack that would also calm the central nervous system. So something like lavender is just a great one. Pelvic floor strengthening exercises are important here. I've never really recommended Kegels, but I'm sure Kegels would fit in here. What I have recommended for people is bouncing on, one of those small trampolines. Actually, I had an 85-year-old woman once who, she didn't have MS, but she had a horrible bladder problem. So I got her to sit on the edge because she couldn't jump up and down on the trampoline. So she just sat on the edge of that trampoline and bounced, and that strengthened the pelvic floor muscles. And you could do the same thing with one of those big exercise balls. Just sit and bounce on it. And anything that you're doing to strengthen the core in here is going to aid the pelvic floor as well. I think something that has become more prominent in the last 10 years is pelvic floor physiotherapy. And they help. And once again, a lot of this is geared towards women because women have that that childbirth factor in there that kind of messes up their pelvic floor. But pelvic floor therapists they specifically help women rehabilitate their pelvic floor muscles. And the pelvic floor can be significant, not just in bladder dysfunction, but in bowel dysfunction too. So if you have bladder problems and chronic constipation, those are two darn good reasons to get off to see a pelvic floor therapist. And sexual dysfunction, those are all great reasons to go and see a pelvic floor therapist. In MS, there's research done with pelvic floor therapy in all three of those areas because they don't separate them all, lower body stuff. So I actually found a good article sort of on what is pelvic floor therapy, how does it help specific to MS, and as soon as we're done here, I'm going to post that in the group. And then of course, if you're just frustrated or you need a quick fix, like to travel or whatever, there are medications that are designed to relax the spasticity. But because they are designed to relax that spasticity, they can also cause grogginess and drowsiness. So not always super helpful, right? Okie doke. Other physical therapies for me, I think acupuncture would be amazing. And I think that manual visceral osteopathic treatment would be helpful too. And I've just got to do a little sidebar to that because I know our American friends, there's a line of medical doctors called osteopaths in the States. That's not what I'm talking about. I'm talking about a manual treatment. So you lay on a table and they work on you for half an hour or an hour. Okay. So you want to check into that. Something that's super important to understand as well is that smoking irritates the heck out of the bladder. In fact, smoking is the number one contributing factor to bladder cancer. So it's an irritant. So if you are still smoking in 2022, quit. Just quit. And I say that very tongue-in-cheek. I know I smoked passionately for years myself. I know it's not that simple, but put it on the top of your priority stack because smoking is just doesn't cut it anymore. Okay? So the last point I wanted to make was don't let your crazy bladder rule your world. Sure, it's embarrassing and inconvenient and all of those things, but you know what? Most of the time, nobody else knows. Even if you have an accident and you think, oh my God, everybody in this whatever knows that I've had an accident. That's probably not true. But when you're going out prepare yourself. I mean, we live in the age of protective pads and protective underwear. So use those. Pack a little strategic bag with an extra pair of underwear and an extra pair of pants so you don't get caught, in a situation where, you are going to be embarrassed. And I know I'm probably preaching to the choir here, but scope places out. Like if I'm going to a new restaurant, I still phone and ask them about accessible washrooms. And, I always, it's just a bad habit. So, don't be embarrassed. Use the resources that are available to us now. We live in a pretty great time that you can, despite bladder dysfunction, you can get out and be very active and participate. In a worst case scenario, there's always Botox, things like Botox injections, which just basically paralyze the spasms. And sometimes it works, sometimes it doesn't. But I think you will find that if you look at some of the things that we've talked about tonight, your bladder will probably be feeling better. And especially, like, I would get on the pelvic floor therapy for sure. I don't...
Go to window.
Okay.
Sorry, she's lost her window of the chat.
Oh, interview chat?
No, conversations.
Oopsie. Sorry.
Go back to window.
I was wondering where everybody was. Can you get your finger out of the way? Thank you. Comments and reactions. Okay. Oh my God, there are people here. Yay.
No distractions.
So I had absolutely no distractions, but at the same time I was going, oh my God, did I hit the wrong button? Like, am I actually live? So let me take a note here to say hi to everybody who's saying hi. I missed L'Angele this evening. Maggie, get out there, girl. Next week. As long as she's doing it for free, I'm showing up, let me tell you. Actually, I said to Mike after, I said, man, I would so pay for that face massage to do it again. So, okay. I started seeing a physiotherapist that specializes. Huh?
Click on the.
Oh, yeah, I can. Quick. So Maggie's saying, I started seeing a physiotherapist that specializes in pelvic floor prolapse, and she's amazing. So thankful to have found her. Exactly. We get sort of stuck in this. Oh, I have MS. Like, do you treat MS, bladder dysfunction? You know what? It's pelvic floor. There's a lot going on in that pelvic floor. If you're a woman, a lot more than with the guys. So, it's a great thing to get to a therapist that specializes that. How do you exercise from a wheelchair? You know what? That's a great question, Rebecca. And there's all kinds of seated exercise out there. You know what I would do if I were you? I would get yourself a trainer, or maybe a neurological physiotherapist to start with. And I mean, when I still have a wheelchair that I use. I picked it up after I had my knee surgery, and I use it sometimes in my little car. I have a lift, so if I want to get out and do things on my own. And I did that once. I went and saw a personal trainer. I had a personal trainer, and I went there by myself in my wheelchair, and he was super helpful. So there's lots you can do, Rebecca, for that. Okay. Exercises for pelvic floor. Sure. Well, you can. Actually, let's do one. And this is one that we can all do. And it's actually a core exercise. And I think I may have done it with you before, but it just shows you how embedded the core and the pelvic floor are together. So that is, we're going to take a nice deep breath in. And when we breathe out, I want you to picture your rib cage dropping and the ribs wrapping around you, pulling your belly button in towards your spine, and then lifting your pelvic floor muscles all sort of in one foul swoop. So nice deep breath in, exhale, feel the rib cage drop, wrap the ribs around, belly button to the spine, pelvic floor up. So you can do those exercises easy peasy. And Rebecca, being in a wheelchair, I would definitely recommend a pelvic floor therapist. So you might need somebody to go with you to help you transfer and such when you're there, but it would definitely be worth it. And L'Angèle is commenting Google for these specific exercises. They are out there. So L'Angèle is our exercise guru here on Transforming MS Naturally. And I would definitely go. And you know what? See what the MS Gym has to offer. I'm sure he's got exercises to work from the wheelchair because, yeah, it's all super important, right? The core, the pelvic floor. Okay, do we have any other questions? I know a lot of people don't want to ask questions about the bladder because it's one of those things that we don't talk about. But I want my main point about this is, what is it I always say? If you're worried about it, you're stressed over it, forgive yourself fast and move on. So you know what? We don't live in a time that we fret about this stuff anymore. We figure out ways to improve quality of life and make sure that we're always moving in a positive direction. So if we don't have any more questions, then I will thank you for coming this evening, and we will see you next week. Thank you. Bye-bye.